So exposure therapy is the planned therapeutic confrontation to a feared situation, object, or memory. Reduction in arousal occurs when people allow themselves to remain in the presence of a feared situation, object for a prolonged period of time. So let's just focus on the person who had a car accident and finds it difficult to drive. So the person might be so scared of the car that you might actually just need them to look at the car and sit in the car and they spend time in the car, then gradually drive the car during a quiet time. They may drive it for a short amount of time and then gradually they increase the driving of the car to busy areas. So we would predict that in exposure that the person would actually get more anxious in the beginning, but if they keep on doing this, we get something called habituation occurring. So habituation means that subsequent exposure sessions provoke less anxiety than previously. So for the example of the person who drives, so if they keep on driving on a Sunday when it's quiet, over time their anxiety would reduce doing that. So they might measure it 8 out of 10 first, and over time it would decrease to like 2, 3, and then they'll be able to do another step that's more difficult. For example, driving on a Monday. There are 4 conditions necessary for effective exposure treatment. Graded, it needs to be graded, it needs to be prolonged, it needs to be repeated, and it needs to be without distraction.